Good evening everyone. I hope you did well in the exam. So let's start the recall session. The surgery questions, depending upon the feedback taken from the students, they said that sir, mixed response was there, means अच्छा paper था, predictable था, but there was some new questions also and it was moderate to difficult, right? But it depends on the student कि उसकी कैसे preparation है. Let's straightforward start the recall. So we discussed multiple times that CEAP is very important. So this is CEAP staging. So guys, can you tell me what is the CEAP of this staging? Here you can see reticular veins and telangiectasia, and whenever you can see reticular veins or telangiectasia, yes, according to CEAP classification this is C1. ठीक है, याद करने का आसान क्या तरीका है, C0 मतलब नथिंग इज देयर, C1 में देर इज telangiectasia, in C2 there is varicose vein, in C3 there is edema, in C4A there is pigmentation, C4B lipodermatosclerosis, C4C it is corona phlebectasia, and what is 5 healed ulcer, and what is 6 open ulcer or open wound. So guys, here what is the correct answer? Since here there is telangiectasia, so here telangiectasia is there, clear, that's why the correct answer is option A, that is C1. Clear? Anybody who wants to add something in the language of question, please message. Okay, so Sarthak, Megha Singh, Bluey, everybody, very good. मैं और कौन? So welcome back guys. Now see the next question. During nasogastric tube insertion, obstruction is encountered at 40 centimeter due to. So you know that whenever you perform endoscopy, there are 3 narrowings, and what is the location of those narrowings from upper incisor? 15 centimeter, 25 centimeter and 40 centimeter. So it is 15, 25 and 40 centimeter. Clear? So here obstruction is encountered at 40 centimeter. Here 15 centimeter from upper incisor. Yes. What is this? 15 centimeter. This is beginning or cricopharynx. 25 centimeter, that is arch of aorta or left bronchus, and 40 centimeter, that is diaphragm. So 40 centimeter, that is diaphragm. So here what is the correct answer guys? Arch of aorta, it will be approximately 25 centimeter. Correct answer is diaphragmatic constriction. So it is 40 centimeter. Easy. Cricopharyngeal constriction, that is at 15 centimeter. Clear? So it is diaphragm. Everybody is correct. So correct answer is option C. During nasogastric tube insertion, obstruction is encountered at 40 centimeter. Okay? Because of diaphragm. Next, a lady got stab wound on thyroid region. Which zone and management? So if you see the zone, this is what? This is suprasternal notch. This is cricoid cartilage. Clear? This is angle of mandible, and this is base of skull. So this is zone 1. From suprasternal notch to cricoid cartilage. Zone 2. From cricoid cartilage to angle of mandible, and from angle of mandible to base of skull, this is zone 3. Can you tell me which one is widest and most accessible? It is zone 2, and thyroid is located in zone 2. Here you can see thyroid gland, it is located in zone 2, right? So lady got stab wound on thyroid region. Which zone and management? Whenever there is involvement of this thyroid and there are structures located posterior to thyroid like trachea, like esophagus, some students were telling that sir, there was air bubble also coming out. It means what is injured? Trachea. So it doesn't matter. There is penetrating injury in zone 2. In this case, what you have to do? you have to go for you have to go for surgical exploration. So, correct answer is option B. We have to go for surgical exploration. Okay, Fit Medicos wants to say that, sir, patient was bleeding profusely. So, patient was bleeding profusely. There was profuse bleeding. There was profuse bleeding, and obviously in this case we have to go for surgical exploration. This is zone 2. So, injury is located in zone 2. We have to go for surgical exploration. Clear, guys? Now, see the next question, very easy question. Given image is of right superficial parotidectomy. Can you see this? Right superficial parotidectomy. Identify the marked structure. Guys, tell me what's the correct answer. Can you see this structure? Marked structure. Okay. Okay, Aryan Garg. Guys, tell me what's the correct answer here. Marked structure. It's very, very easy. I gave you the hint also. Yes. So, guys, see. Yes. Very good. See, it's not facial nerve. Clear? Facial nerves are having branches, right, like this. Okay. It is not the parotid gland. You can see this structure. Have a look of this structure. Clear? So, it's a vein. Can you tell me which vein? So, guys, this is the vein. Yes, which vein? Right. So, guys, this is what? External jugular vein. It's not the parotid gland, and it is obviously not the muscle. So, it's very, very easy. Clear? So, you can notice here that this is the vein. Clear? So, this is the vein, and what is this vein? This is external jugular vein. So, name of this vein? This is external jugular vein. So, correct answer here. Correct answer is option B. This is external jugular vein. Okay. Somebody is saying that this question was not there, but I think some students were saying that, sir, there was intraoperative image of parotidectomy. Clear? Okay. Somebody is saying that digastric muscle was also in the option, right? Okay. These options were not there. Okay. So, what were the options, guys? One is digastric muscle. Okay. So, it will be covered in anatomy then. Digastric muscle was there in option. Okay. Right. So, question was different. Okay. Trigger pointer. Okay. So, it might be covered in anatomy. Okay. So, let's skip this question. Next one. During laparoscopic cholecystectomy, a lateral injury, there was lateral injury to the common bile duct. Okay. What is the most appropriate next step in the management? Guys, see this question and tell me, was there any change in the language or the same language was there? During laparoscopic cholecystectomy, lateral injury to CBD. What is the most appropriate next step in management? Okay. Now, just have a look. Imagine this is liver. You got it? This is gallbladder. This is bile duct. Okay. Whenever any kind of bile duct injury is detected intraoperatively, what is the preferred approach? It's better to repair it intraoperatively. So, we have to go for intraoperative repair. We have to go for, surgeon is not skilled. Okay. Surgeon was not skilled. Surgeon was not skilled. Surgeon was not skilled. Do ERCP and stenting. Okay. Close the abdomen and refer for ERCP. It's already there. Surgeon is not skilled. Okay. So, surgeon was not skilled, and during laparoscopic cholecystectomy, lateral injury to CBD was identified. Now, see, if surgeon is skilled, then you can go for laparoscopic CBD repair. Since surgeon is not skilled, obviously we have to convert it to open. Surgeon is not skilled, injury is there, so convert it to open, and after converting it to open, try to repair, and whenever you are going to repair, put the T-tube. So, guys, see the options. Continue the laparoscopic procedure and place a drain. No, because surgeon is not skilled. Second, convert to open procedure and with T-tube drainage. Preferred answer. Ligate and close proximal, ligate the duct proximal to injury. No, we are not going for ligation. Close the abdomen and refer for ERCP. No, we are not referring the patient for ERCP. Clear? So, it's better convert laparoscopic cholecystectomy into open and they perform the repair, and after repair you have to place the drain. Clear? So, guys, what is the correct answer here? Correct answer is B. So, you got the crux of the question. Surgeon is not skilled, that's why laparoscopic bile duct injury which was detected intraoperatively. Yes, you convert it to open, repair it, and after repair we have to put the T-tube. Got it? So, correct answer is option B. Now, see the next one. During OPD, a child was brought with the following condition of right ear. Can you tell me, guys, what's the diagnosis here? Here, the diagnosis is microtia. Clear? So diagnosis you can see here is microtia. And what is the best age for repair? Microtia is best repaired at 3 to 10 years. Best age for repair is approximately 3 to 10 years. So obviously 1 year it's incorrect. Can be done at presentation. Age is not mentioned. So what is the preferred answer here, guys? The preferred answer is 5 to 6. Vishnu, very good. So preferred answer will be 5 to 6 years. So microtia, we have to perform the repair at 5 to 6 years of age. Preferred age is 3 to 10 years. Clear? Now see the next question. Very, very easy, and it was asked multiple times. It's a repeat question. 70 years old man during TURP procedure under spinal anesthesia developed confusion and irritability. What is the best next step for the management? Guys, first tell me, what's the diagnosis here? Why this patient developed confusion and irritability? Yes? What is the cause, guys? Tell me. Here, this patient developed what? Hyponatremia, that is known as TUR syndrome. This is known as dilutional, what? Dilutional hyponatremia. And whenever patient is having dilutional hyponatremia, what you have to give? Yes, you have to give IV furosemide. And IV furosemide is given. Even after IV furosemide, when excess fluid is taken out of the body, still patient is not improving. In these cases, we have to give hypertonic saline. So first, drug of choice, furosemide. Fluid of choice, hypertonic saline. So guys, this is the drug of choice and this is the fluid of choice. Drug of choice, fluid of choice. So obviously first we go for IV furosemide. Still patient is not going to improve. Still patient is not going to improve. Then go for hypertonic saline. Okay, one option was change glycine. One option was change 1.5% glycine to normal saline. No, we are not going to change it to normal saline. Why we are not using normal saline for irrigation? Because normal saline, if you are using cautery with normal saline, you know that this is electrolyte, it is going to break into sodium and chloride. And because of that, what will happen? The cautery energy will be dissipated locally. So in TURP, whenever you are using whenever you are using monopolar cautery, you are not using what? Any electrolyte solution. So for irrigation, we are not using normal saline. We will be using 1.5% glycine only. Got it? So here, what is the correct answer? Administer IV furosemide. Okay. Correct answer is option C. After that, guys, tell me what's the correct answer here. Can you see this image first? There were two questions. Students were telling that, sir, one question was there of ureterocele. Okay. And can you see this question? So guys, here you can see there is upper pole hydronephrosis. Because of that, what happens? There is drooping of lower pole. And drooping of lower pole means the lower pole of kidney is displaced inferolaterally. And since it is displaced inferolaterally, ये कैसा दिखता है? बताइए how it looks like. Can you see? It is drooping lily. Okay. So one question was there related to what? Ureterocele, that is adder head and cobra head appearance. And second question was related to drooping lily. So in ureterocele, you guys already know ureterocele में क्या मिलेगा आपको बताइए. You are going to get adder head or cobra head. Adder head or cobra head. Okay. So students are saying that, sir, drooping lily was not there. ठीक है. Only one question was there related to ureterocele, and in ureterocele there is adder head or cobra head appearance. Clear? Can you tell me drooping lily sign is seen in which condition? It is seen in neuroblastoma. And it is seen in ectopic ureteric orifice. Neuroblastoma and ectopic ureteric orifice. And the traditional question is what? Adder head or cobra head appearance. वो किस में देखने को मिलेगा? Obviously it is seen in ureterocele. Okay, ठीक है. Somebody saying थी sir drooping lily भी था और cobra head भी था. ठीक है. So we discussed both, guys. We discussed both. Drooping lily, it is seen in neuroblastoma. It is seen in ectopic ureteric orifice. And whenever there is adder head or cobra head appearance, if there is adder head or cobra head appearance, in that case, adder head cobra head appearance, there it is seen in obviously ureterocele. But photo अलग थी, ठीक है. इसमें नहीं दिख रहा है, photo अलग थी, ठीक है. Okay, next question. Ductal carcinoma in situ treated with lumpectomy and was found to have margins of 2 cm. What was the language? Some students were telling that, sir, what? Lumpectomy was done. Patient was having a breast lump. Lumpectomy was done. Okay. When the specimen was sent to pathology department, it was DCIS. DCIS with 2 millimeter margin, 2 millimeter margin, 2 millimeter margin. Roughly for wide local excision, how much margin we take? Yes guys, 1 centimeter. And whenever you are going for breast conservation surgery, how much margin you are going to take? 1 millimeter, right? Okay. Basement membrane was intact. Basement membrane was intact. Okay. Margin was negative. Margin was negative. So, basement membrane was intact, margin was negative. And chemotherapy option was also there. Chemotherapy option was also there. So, guys, let me tell you what is the management of DCIS. In majority of cases, how we are going to manage ductal carcinoma in situ. In majority of cases, what? Wide local excision or lumpectomy is sufficient. If negative margin is there, lumpectomy is sufficient. If tumor is not higher grade, tumor is not having higher grade, in those cases there is no requirement of radiotherapy also. So, ideally you should go for regular follow up. Clear? But if in the question it is mentioned what, that the tumor was high grade or margins are positive, in these cases we will go for radiotherapy. So, everything will depend upon exact language. Okay? So, only conservative, right? So, agar margin is negative, basement membrane intact, then go for regular follow up. And if it is positive, margins are positive or tumor is high grade, in that case radiotherapy. So, radiotherapy किस case में देंगे? Whenever margins are positive or tumor is high grade tumor. In these cases we will go for radiotherapy, otherwise here the correct answer will be option D. More than 2 centimeter margin was removed. Okay. More than 2 centimeter margin was removed. More than 2 centimeter. Okay? Clear? So, here the correct answer is regular follow up. Next question guys. Woman presents with rectal bleeding. Clear? And there is pain during menstrual period. During rectal examination, there is a polyp on anterior part of rectum. What's the correct answer? Guys, tell me, the same language was there or some addition was there? Polyp on anterior part of rectum. Okay, it was endometriosis. ठीक है? Actually speaking, because it is related to menstrual period. Yes, so actually it is related to what? Endometriosis. Cyclical rectal bleeding. Very good. So, cyclical rectal bleeding is there. So, obviously what's the correct answer guys? If there is cyclical rectal bleeding, then obviously what's the correct answer? Correct answer is go for endometriosis. Obviously it's gynae question, right? ठीक है. Next, a 5-year-old child brought to the emergency department with difficulty to breathe. Yes, it was dyspnea or dysphagia, guys. It was dyspnea or dysphagia. Difficulty to breathe or difficulty in swallowing. Clear? Obviously, यहाँ देख के आप देखिए, if you are going for chest X-ray, PA view, on PA view, guys, you can see what? The flat surface. So, on PA view, you can see the flat surface. On the lateral view, you can see the edge. So, PA view, you can see the flat surface. Lateral view, you can see the edge. So, this is typically seen in esophagus. Clear? So, the coin is typically lodged in esophagus. In trachea, on PA view, you can see the edge. On the lateral view, you can see the flat surface. So, guys, it is esophagus. Correct answer is esophagus. Okay? Next question. 23-year-old female underwent renal angiography. Can you see this? Renal angiography. Following are the findings. What is the likely cause? So, can you tell me what is this appearance, guys? Can you see this? This appearance. This is known as string of beads appearance. On renal angiography, you are going to get this string of beads appearance. And what is the cause of this string of beads appearance? Tell me. Yes, there is stenosis with small aneurysm. Stenosis with small aneurysm, and you know it is typical feature of fibromuscular dysplasia. So, this is typical feature of fibromuscular dysplasia, string of beads appearance. Clear? Somebody said that, sir, polyarteritis nodosa was also there, PAN was also there. Clear? So guys, correct answer is fibromuscular dysplasia. This is string of beads appearance. There is stenosis with small aneurysm. Okay, clear? So everybody is almost correct. Everybody, this is fibromuscular dysplasia. Now see the second question. This is easiest question, guys. You can see just on the basis of this barium study, you can make the diagnosis that patient is having what? Zenker's diverticulum. Zenker's diverticulum, can you see this? Patient is having Zenker's diverticulum. Okay, let's read the question. 65 years old man, there is dysphagia, halitosis, regurgitation of undigested food several hours after eating. What is the likely diagnosis? So all of you know the likely diagnosis is Zenker's. Zenker's, clear? So it is Zenker's. Okay, they asked about the muscle also. Correct answer, Zenker's. Between the two muscles, कौन सी muscle है? Yes, there is Killian's dehiscence. Guys, you know that these are oblique fibers of thyropharyngeus. These are the transverse fibers of cricopharyngeus. And you can see here, this is the defect, and this defect is known as Killian's dehiscence. And via this defect, there is herniation of mucosa, submucosa. This is Zenker's. Next question. 67 years old male presented with tortuous vein of the left lower limb. Yes, can you tell me what is this vein? This vein is located over which aspect? You can see which aspect of lower limb. This is anteromedial aspect. So guys, this is anteromedial aspect. Since it is located on anteromedial aspect, varicose vein is involving which vein? Tell me. Varicose veins involving long saphenous vein or great saphenous vein. So this is great saphenous vein. So correct answer is great saphenous vein. Correct answer is option A. Okay. Next. Mother noticed swelling in groin region with child while child was coughing and crying. So whenever a child is coughing or crying, mother noticed a swelling. So usually what is this actually? Patient is having hernia. What kind of hernia? In females, in children as well as in males, usually what is the most common type of hernia, guys? You know, this is deep ring, this is superficial ring. So this is indirect inguinal hernia. So this is indirect inguinal hernia coming out via deep ring, traversing the inguinal canal and then coming out via superficial ring. So what is the correct answer here? Medial was written, okay. Medial to what? Medial. Medial, yes. Guys, see. Suppose the question is like this, yes, this is inferior epigastric artery, clear? This is inferior epigastric artery, and if hernia is medial to inferior epigastric artery, clear? This one is direct inguinal hernia. अगर ऐसा लिखा होगा, if it is medial to inferior epigastric artery, this is direct, and if it is lateral to inferior epigastric artery, lateral है तो indirect होगा. If it's medial है तो direct होगा, and if it's lateral, that is indirect, and if medial lateral is not mentioned, then obviously the correct answer would be what? Indirect inguinal hernia. Correct answer would be indirect inguinal hernia. मीडियल अगर लिखा था, अगर मीडियल लिखा था inferior epigastric artery के रिलेशन में, yes, inferior epigastric artery के रिलेशन में होगा, then what? Direct inguinal hernia. Somebody is saying that, sir, undescended testis. Guys, see, swelling noticed in groin region while child was coughing and crying. Coughing, crying पे undescended testis बढ़ेगा नहीं. What is the problem in undescended testis? Undescended testis, if it's palpable, it is in inguinal canal. It has nothing to do with what? Coughing and crying. Clear? So if there is a swelling which becomes more prominent on coughing or crying, means on intra-abdominal pressure, when the intra-abdominal pressure is increased, swelling becomes more prominent, it's hernia. If it's lateral to inferior epigastric artery, indirect inguinal hernia. If it's medial to inferior epigastric artery, that's direct inguinal hernia. Got it? Just medial, nothing was mentioned, just medial, so medial to what? If the medial location is there, guys, it is direct. Lateral hai to indirect. Okay? So here if medial, it is direct. If it's lateral, indirect. Depending upon the question, language. Next, 43 years old female, what is the size of lump? 4.6 centimeter. Yes, and there is axillary lymph node which is mobile without distant metastasis. So guys, you know that T1 is up to 2 centimeter, T2 is more than 2 to 5 centimeter, right. So here 4.6 means it is T2, it is T2, and there is mobile axillary lymph node. So that is T2N1, and we discussed multiple times what is the stage. Stage 1 is T1, stage 2A is T021N1 and T2, and stage 2B is T2N1. Stage 2B is T2N1. So what is the correct answer here? The correct answer is stage 2B. Same side lymph node, yes. So it is stage 2B, stage 2B. So correct answer is option B, that is stage 2B. Okay. Next, identify the type of skin graft. You can see the meshing in the graft. So guys, this is the meshing in the graft. Two types of skin graft, STSG split thickness, FTSG full thickness. In STSG we are taking epidermis plus part of dermis. We are taking epidermis plus part of dermis, and you know that in full thickness skin grafting we are taking what? Epidermis plus full thickness of dermis. So it is epidermis plus full thickness of dermis. Got it? Here you can see the meshing. This is split thickness skin grafting. So correct answer is option B. This is split thickness skin grafting. Why meshing is done? Whenever the graft available, you know, the area burnt is too much and we don't have graft available. So just to increase the area we are doing this meshing. Clear? Correct answer is B. After that you can see the next question. Very important and very easy question. 22 years old male sustained burn, presented to emergency department. On examination, very important, nasal hair were singed. Blood investigation, carboxyhemoglobin raised to 18.5, and what? Oxygen saturation was 81%. Now guys, any patient in whom you suspect inhalational burn like patients who are having some kind of dyspnea at the time of presentation, yes, there is singed or burned nasal hair, and carbonaceous deposit is there on the sputum. At the time of presentation there is hoarseness of voice. In all these cases, what? Elective intubation is safest. But if you are not doing elective intubation, very soon what will happen? Patient will develop laryngeal edema, and if patient will develop laryngeal edema, then intubation becomes very difficult. So here what is preferred? Elective intubation is preferred. Elective intubation, because patient is having inhalational burn. So elective intubation is preferred. So A is correct. 100% oxygen with non, this is incorrect. Fluid resuscitation, no. Tracheostomy is done when laryngeal edema is there और patient को intubate आपने नहीं किया है. So guys, in this case what? Intubation. And what is safest? Elective intubation is safest in such patients. Burnt body surface area 18% था, 18.5. Okay, patient was having 18% burn, doesn't matter. Yes, most important is that whether patient is having inhalational burns or not. So correct answer is option A. Next question, you can see this is very important. थोड़ा सा देख लीजिए आप. Patient is having crush injury. Can you see this? Crush injury, right? So after a mass accident on national highway, 20 years old male was brought with the following finding. What is the color coding? So guys, what is the color coding? Nowadays there are 5 color codes. Red is for life threatening injuries. Example, red, immediate care, because patient is having life threatening injuries. Classical example, if the patients are having tension pneumothorax, patients who are having massive hemothorax or EDH, within minutes to hours patient can die. Tension pneumothorax, massive hemothorax, EDH, immediate care should be provided. Yellow, urgent care should be provided. Here serious but not immediately life threatening, like patients who are having compound fracture. Serious but not immediately life threatening. So compound fracture, or patients who are having visceral perforation. Right? So this is serious. Okay, building collapse है, ठीक है. Building collapse है, this is serious. So guys, here the correct answer is yellow, urgent care. What is blue? उसके पहले green देखिए. Green, what? Green, delayed treatment. If the patient is having simple fracture or minor laceration, yes, patient should be referred to the hospital. खुद से जाएगा. Clear? Green. Blue, patient is having extensive injury जिसके लिए हमारे पास resources available नहीं है. Black, patient is already dead or moribund. So patient is already dead or moribund. So here what is the correct answer guys? Correct answer is चाहे compound fracture है, crush injury है, visceral perforation है, in all these cases we go for yellow. Okay, severe bleeding, degloving, ठीक है, degloving injury is yellow. Yes, it's yellow guys. ठीक है, immediately life threatening, जैसे टेंशन हीमोथोरैक्स है, मैसिव हीमोथोरैक्स है, EDH है, in that case it's red. Clear? Next, child is born with following finding. What is the best age in the line of management? Guys, can you tell me what is the correct answer? Obviously diagnosis is cystic hygroma. Cystic hygroma. ठीक है? Now see, age of repair depends on the presentation. Suppose at birth the child is having signs and symptoms of airway obstruction. If it is causing airway obstruction, in that case immediate surgery. Immediate surgery if in question it is mentioned that child is having airway obstruction. But if airway obstruction is not mentioned, in that case the preferred age is 2 to 5 years. Obviously we have to go for surgical excision, and the preferred age in cystic hygroma, it is 2 to 5 years. Okay? One option was sclerotherapy. One option was sclerotherapy. Sclerotherapy was one. Clear? So sclerotherapy is also done, but surgical excision is preferred. Surgical excision, it is preferred over sclerotherapy. Sclerotherapy, and here what is the preferred answer? Operate after 1 year of age. अगर क्वेश्चन में ऐसा लिखा होता, if it's mentioned that patient is having airway obstruction, immediate repair, no airway obstruction, perform the repair around 2 to 5 years, and surgical excision is preferred. Surgical excision is preferred over sclerotherapy. Easy. Now see the next question guys, easiest question, you can see this. This is ranula. You know, it's a clinical diagnosis. Patient is having cystic swelling in the floor of mouth arising from sublingual gland. This is ranula. So what's the correct answer? Ranula. This is ranula. Next question guys, next, very very easy. What is the best investigation to check for extrathyroidal spread of thyroid gland neoplasm? Easy question. Let me tell you, any malignancy which is there in head and neck or malignancies in the pelvis, investigation of choice for staging, yes, it is MRI. So if you want to assess the extrathyroidal spread of thyroid malignancy, what you have to go for guys? You have to go for MRI. But if you have to go for distant metastasis, for distant metastasis, PET scan is preferred over whole body scan. Distant metastasis, PET scan is preferred over whole body scan. Here we go for MRI. Okay, MRI. Somebody saying that sir image was there, image भी दिया हुआ था. Okay, ठीक है. Now ranula का treatment क्या है? Whenever there is ranula, what is the treatment guys? In cases of ranula, we are going for marsupialization. It is marsupialization, and if you know that patient is having recurrence after marsupialization, if there is recurrence, in that case we go for excision. Recurrence, then we go for excision. Easy. Next question, very very easy. Trauma patient presented with severe respiratory distress, hypotension, BP 80/50, distended neck veins, X-ray given below. You can see this patient is classically having tension pneumothorax. You can see the collapsed lung, the margin you can see here, you can see the margin. Clear? So collapsed lung, tension pneumothorax. In this case what? Immediately you have to put a wide bore needle in 5th intercostal space, in anterior axillary line in adults, and 2nd intercostal space in mid clavicular line in children. ठीक है? But students were saying that sir 7th intercostal था, 5th नहीं था, 5th नहीं था, 7th था. ठीक है? So obviously we are not going for needle decompression at 2nd intercostal space, then mark 7, though it's not correct. Clear? Intubation करने की ज़रूरत नहीं है. So guys, ideally it should be 5th, but not given, then mark the 7th. Mark the 7th because 2nd intercostal space हम बच्चों में करते हैं. Clear? Age of patient was mentioned in the question guys. Age was mentioned. Age, अगर बच्चा होगा so 2nd, adult 5th, not given, not mentioned. Adult patient था, so if adult patient, so if 5th is not there, obviously what? Go for 7th, right? But that's not correct. Next, What is the most common cause of posterior duodenal ulcer bleeding? Yes, you can see here, this is stomach, this is the duodenum, and there is one artery passing like this. Guys, what is the name of this artery? All of you know, this is gastroduodenal artery. You know that anteriorly located ulcers perforate, posteriorly located ulcers bleed, and in this case there is involvement of which artery? Gastroduodenal. So everybody is correct. The correct answer is gastroduodenal, right? Option C. Next question, very easy. What is the likely diagnosis of X-ray below? Guys, this question was asked multiple times previously, and you can see this is silolithiasis. This is salivary gland stone. कौन से gland में होता है सबसे ज़्यादा silolithiasis? 80% of salivary gland stones are seen in submandibular gland. 80% of salivary gland stones are radio opaque. And what you have to do? See, this is the salivary gland. कौन सा? Submandibular. If the stone is in the duct, stone is in the gland. अगर duct में है, give the incision, remove the stone. But if the stone is in the gland, go for excision. So treatment was asked, diagnosis is silolith, and guys, the treatment, excision of gland. Excision of gland. So which gland? Submandibular gland. So we are going for excision of submandibular gland. Clear? So diagnosis silolithiasis, and the treatment is excision of, okay, excision of submandibular gland. ठीक है? No, don't. Yes, if it is in the duct, then give the incision, remove the stone. But if it is in the gland, then remove the gland. Submandibular gland. ठीक है? Total? Yes, we have to go for total excision. पूरा gland निकाल देंगे. We have to remove the whole gland. ठीक है? No, we have to go for removal of gland, not only stone. ठीक है? Next question. Guys, tricky question. Can you tell me the exact language? Patient is having rectal prolapse. ठीक है? This is rectal prolapse. And when a patient is having rectal prolapse, right? Patient is having protein energy malnutrition, worm infestation, diarrhea. Treat the underlying cause, right? But even after treatment of underlying cause, still patient is having the problem. Then we go for rectopexy. So 5-year-old female brought to the OPD. There is red mass protruding from the anal verge after defecation. Mass is 4 cm long. Demonstrate concentric mucosal fold. What is the most likely diagnosis, guys? It is full thickness rectal prolapse. This is full thickness rectal prolapse. Prolapse. ठीक है? अब इस केस में कौन सा करेंगे? एब्डोमिनल और पेरिनियल. What is the problem? Let me tell you. Adult patients who can tolerate the surgery, the patients who can tolerate the surgery, patients who can tolerate the long duration surgery, in these cases we go for abdominal. And the patients who cannot tolerate long duration surgery, in those cases we go for perineal. Perineal in elderly patients, yes, frail patients. So injection sclerotherapy, no. Suture rectopexy, conservative management, Thiers stitch, suture rectopexy. Preferred is ओके 2 years old boy था, ठीक है, 2 years old boy, 2 years old boy. All options are there. Thiers भी था, Thiers, Delorme was there, Thiers was there, Altemeers or okay, digital rectal examination, digital reposition. Second option was digital reposition. So digital reposition should not be done. Why? Because this is not the permanent solution. Then you have to choose between VAR and PAD. VAR and PAD. Clear? I discussed that abdominal rectopexy will be done in adults, but if a patient is frail, in those cases we go for perineal. So इसमें preferred क्या होगा? Then go for Thiers. Guys, then go for Thiers. ठीक है? Because abdominal में क्या क्या होता है? Wells and Ripstein. These are abdominal. PAD में क्या क्या होता है? Altemeers, Delorme. So perineal is Altemeers and Delorme. ठीक है? VAR is done in adults. VAR. ठीक है? Altemeers and Delorme. एब्डोमिनल में क्या है? वेल्स एंड रिप्स्टीन. सो वेल्स और रिप्स्टीन करते हैं इसमें. ठीक है? अब इस केस में, ठीक है, बच्चा 2 साल का है, प्रीफरेबली गो फॉर थियर्स. right? It depends. Suppose the child is having some other comorbidity like meningomyelocele, or the child is having sacral agenesis. In all these cases we are going for Triage. वैसे बच्चों में हम एक special rectopexy करते हैं, that is Lockhart Mummery rectopexy. So guys, preferred is suture rectopexy or go for Triage. ठीक है? Okay. Malnourished, it depends, right? So malnourished, protein energy malnutrition सबसे पहले हम treat करते हैं, and after that still patient is not improving, then only we go for rectopexy. ठीक है? This is the concept. Next, after binge drinking, patient developed thoracic pain, vomiting and cervical subcutaneous emphysema. What is the preferred investigation for the diagnosis? So guys, can you tell me what is the name of this triad? All of you know that this is Mackler's triad. Patient is having Mackler's triad, clear? Patient is having Boerhaave syndrome, and what is the investigation of Boerhaave syndrome? Contrast esophagogram. Contrast esophagogram. और इस केस में क्या करेंगे? No, endoscopy is not done. What we do, we have to give contrast orally, ठीक है? And then we can take CT or X-ray. Which one is preferred? CT. So CT with oral contrast. And which contrast we are using, guys? We are not using barium. We are using mainly water soluble contrast like gastrographin. So here the preferred answer would be option B. Barium swallow, it's not the first line. It is water soluble contrast esophagogram which is preferred. Water soluble contrast esophagogram which is preferred. ठीक है? तो यहाँ पे CT with oral contrast, that is preferred. Diagnosis you will do to confirm? Yes, we are going to do CT with oral contrast to confirm the diagnosis. ठीक है? Correct answer is B. Next question. After thyroid surgery, female is not able to sing in the temple. Which of the following nerve was injured? First, you tell me, guys, what is the most commonly nerve injured during thyroidectomy? So it is external branch of superior laryngeal nerve. That is external laryngeal nerve. Recurrent laryngeal nerve can also be injured. Whenever there is injury of recurrent laryngeal nerve, these patients are having hoarseness of voice. Hoarseness of voice. ठीक है? And whenever patient has to increase the pitch, here superior laryngeal nerve is required to raise the pitch. So to raise the pitch, superior laryngeal nerve is required. So here patient is not able to sing in the temple. So what is the correct answer? Correct answer is superior laryngeal nerve. So it is okay. Correct answer is obviously it is external branch of superior laryngeal nerve. External branch, okay? और अगर दिया है external laryngeal nerve, so obviously guys this is preferred answer. So this is external branch of superior laryngeal nerve which is also known as external laryngeal nerve. अगर external laryngeal nerve है, so that is correct answer. And you know that is the most commonly injured nerve during thyroidectomy. Next. There was a similar question. Patient was having malnutrition and patient was having diarrhea. There was calcification of the pancreas, serum amylase and lipase was normal. What is the next step? If you see the scenario, malnutrition, steatorrhea, इसका मतलब what? Patient is having indigestion. Clear? There is malabsorption. And why patient is having malabsorption? What happens if there is calcification? So it's a typical feature of chronic pancreatitis. In chronic pancreatitis क्या क्या feature होता है बोलिए? In chronic pancreatitis, first of all, there is exocrine insufficiency. There is exocrine insufficiency. After that, there is endocrine insufficiency. After that, there is chronic pain. Chronic pain. CT was given. Calcification के लिए CT दिया हुआ था, that's better. तो अगर CT दिया है, obviously patient is having findings suggestive of chronic pancreatitis. क्या करेंगे इसमें? Guys, we have to go for enzyme replacement. So what? Pancreatic enzyme supplements. So we have to give pancreatic enzyme supplements. For diabetes, we are giving insulin, and for pain, we are giving analgesics. So obviously the correct answer would be option A. Option में क्या क्या था? शिवानी, Indra, Indu. What were the options? Whipple's procedure, no need to do Whipple's. Guys, we are not doing Whipple's here. Whipple's procedure. Whipple's procedure should not be done. ठीक है? Okay. So here, preferably we go for enzyme replacement because patient is having chronic pancreatitis. Okay, there was one question with neoplasm of head of pancreas. So guys, if there is neoplasm of head of pancreas, in that case obviously we go for what? Pylorus preserving Whipple's procedure. So neoplasm of head of pancreas, इस केस में हम करते हैं क्या? Pylorus preserving Whipple's. In this case we go for pylorus preserving Whipple's procedure if there is neoplasm of head of pancreas. तो यहाँ क्या आंसर होगा? Here the answer would be enzyme replacement. और अगर head of pancreas में there is a mass or tumor, malignancy is there, then go for pylorus preserving Whipple's procedure. Next question. Easy question. Somebody said that sir, trauma patient was there and there was lucid interval. Lucid interval was there. Lucid interval. ठीक है? Okay. So you can see here this patient is having EDH, extradural hematoma. Say in extradural hematoma you can see biconvex hyperdense lesion. Biconvex hyperdense lesion. So this is EDH. Okay, EDH. ठीक है? Right. Now see the next question, guys. Angular dermoid. Some students were telling that sir, there was swelling over the outer angle of eye. Similar picture was there. So guys, what is this? This is angular dermoid, and in angular dermoid obviously what's the treatment? The treatment is surgical excision. Surgical excision. Some students are telling that sir, CEAP classification में edema mentioned था. Okay, Dr. M. Alam, अगर mentioned था तो C3 होगा, नहीं था तो नहीं होगा. If there is only telangiectasia or reticular vein, we discussed. अगर था only telangiectasia or reticular vein, it is C1, varicose vein 2, edema 3, lipodermatosclerosis, pigmentation है 4A, lipodermatosclerosis 4B, corona phlebectasia 4C, and if healed ulcer is there, it is 5, and C6 open ulcer. ठीक है? So this is angular dermoid. Some students were telling that sir, there was one question related to squamous cell carcinoma of penis. Penis में कुछ growth थी. Guys, tell me, squamous cell carcinoma. Penis. Anybody remembers the question? Chancroid. Okay, it was chancroid, not squamous cell carcinoma. ठीक है? That would be covered in skin. Chancroid was there. Okay, so that will be covered in skin. ठीक है? Next, you can see there was thyroid swelling moving with deglutition. ठीक है? Okay, guys. Next, thyroid swelling. Bowen's disease was there. Somebody saying that sir, Bowen's disease था. There was Bowen's disease. Bowen's disease मतलब carcinoma in situ involving penis. So it is carcinoma in situ involving penis. ठीक है? If there is carcinoma in situ involving penis, this is Bowen's disease. There was one question related to thyroid. Guys, anybody remember? Midline swelling moving well with deglutition. Old patient glans penis पे red color का growth था. If it is looking malignancy, guys, Bowen's disease. Not moving with deglutition. ठीक है, हो सकता है वो दिया हो just to confuse you guys. Chancroid में भी similar manifestation होता है. No, moving with deglutition, not moving on protrusion of tongue. Tongue protrude करने पे move नहीं होगा. That is not thyroglossal cyst. What is the special feature of thyroglossal cyst? It moves up on protrusion of tongue. So moving with deglutition, but not moving on protrusion of tongue. Anybody remembers this? Not moving on protrusion of tongue. Okay. Not moving on protrusion of tongue. Anybody remembers the option? Protrusion of tongue. Anybody remembers the option? Guys, options. Anybody remembers? Okay. Okay, guys, if you remember, please message. ठीक है? ओके मैनेजमेंट वाज आस्क्ड, ठीक है. अगर थायराइड स्वेलिंग है, मैनेजमेंट है, सो ऑब्वियसली वी गो फॉर व्हाट, हेमीथायरॉइडेक्टमी. एंड इफ इट्स मैलिग्नेंट वी गो फॉर टोटल थायरॉइडेक्टमी. ठीक है. नेक्स्ट, beetle nut chewing, there is mass protruding through the mouth. Somebody was telling that, sir, the mass was arising from, or the malignancy was arising from tongue. So there is a malignancy arising from tongue. In this case, which kind of biopsy should be done? Guys, whenever patient is having oral cavity malignancy, in these cases we go for edge biopsy. What is the investigation of choice? We go for edge biopsy. So this is squamous cell carcinoma of oral cavity. Even if, okay, just below tongue, so it was below tongue, it was below tongue. And what is the investigation of choice for diagnosis? We go for edge biopsy. ठीक है. स्मॉल अल्सर, वेज बायोप्सी. ठीक है, एज बायोप्सी. ठीक है, वेज बायोप्सी. पंच बायोप्सी इज नॉट डन हियर. वी आर नॉट गोइंग फॉर ब्रश बायोप्सी और पंच बायोप्सी. यूजुअली वी गो फॉर एज बायोप्सी. नो एज, सो गो फॉर वेज बायोप्सी. ठीक है. नो नो नो, ब्रश बायोप्सी इज नॉट डन गाइज. वेज, ठीक है, वेज बायोप्सी. वी आर नॉट गोइंग फॉर ब्रश बायोप्सी. ठीक है, वेज भी दिया था, गो फॉर इट. नेक्स्ट क्वेश्चन. दिस क्वेश्चन वाज देयर गाइस, समबडी वाज टेलिंग सर इमेज बेस्ड क्वेश्चन था ये वाला. आप नोटिस कर सकते हैं क्या? कैन यू सी हियर, हियर कैन यू सी दिस? व्हाट इज द नेम ऑफ दिस? दिस इज फैट हैलो साइन. कैन यू सी दिस? यस, there is submucosal fat around the bowel, and you can notice that here it is comb sign, vascular jejunization of ileum. So comb sign, exact image tha, very good. So this is Crohn's disease guys. You can see vascular jejunization of ileum, and this is fat halo sign. So comb sign and fat halo sign. So this is comb sign, that is vascular jejunization of ileum, and this is fat halo sign. So comb sign, fat halo sign. So obviously you know correct answer is Crohn's disease. This is Crohn's disease. Somebody is telling me that sir torsion भी था, gut, अच्छा gut malrotation था. Okay, option was gut malrotation. So option was gut, it was gut malrotation. Obviously it's not gut malrotation. It was not gut malrotation. Cox abdomen, ठीक है, Cox abdomen, okay. Malignancy भी था ऑप्शन में, ठीक है. Ileal carcinoma was there, ileal carcinoma. So guys, what is the correct answer? This is actually Crohn's disease, Crohn's. Now see the next question. What is the diagnosis? Very very easy question guys. Can you tell me? No no no, that was not malrotation guys. Don't have this confusion. ठीक है, classical same picture was there. ये Crohn's disease है. There is fat halo sign and vascular jejunization of ileum, that is comb sign. Guys, same picture. Okay, so same exact same picture was there, and you can see here what? You can see the abscess cavity. Can you see here guys? There is abscess cavity. Yes, in the liver. So this is abscess cavity in the liver. See, this is liver abscess. So what's the diagnosis? Obviously it's liver abscess. It is not HCC. Why? Because in hepatocellular carcinoma what happens? There is arterial hypervascularization with venous washout. In hydrated cyst, the picture is something like this. Inside the cyst, these are the lesions. A long history, ठीक है. There is a long history suggestive of liver abscess. So correct answer is A. There was history suggestive of liver abscess. Means alcoholic male, patient is having pain in right upper quadrant of abdomen, patient is having fever with chills and rigor, anorexia, fatigue. ठीक है, fever था, tenderness था. ठीक है, patient was having fever, patient was having pain and tenderness. Patient was having fever, pain and tenderness. Metastasis to the liver was also in the option. Metastasis, liver metastasis. Okay, fever, HIV positive. Patient was HIV positive and increased enzymes. Fever, malaise. So patient was having fever, malaise, HIV positive, increased enzymes. So guys, it's classical history of liver abscess. Liver abscess, okay. Drug abuser tha, drug abuser, very good. Guys, can you tell me, if patient is a drug abuser, can anybody tell me what is the organism responsible? if a patient is drug abuser, in drug abuser there is increased risk of endocarditis, and this infection reaches liver via hematogenous spread. So anybody can tell me which organism will be there? Very good, Nivethi Selvi, very good. Nivethi, you are absolutely correct. So in children who are having granulomatous disorders, the patients who are having a bacterial endocarditis, in those cases there is hematogenous spread and the organism is Staph aureus. Usually most common route is bile duct followed by portal vein, and the most common organism usually that is E. coli followed by Klebsiella. Okay, easy. Okay guys, next question. Match the following. Students were telling me that sir, there were multiple, there was one question and there were options about autoantibodies and the conditions. Autoantibodies दिया हुआ था and it was related to matching. So guys, Graves के लिए क्या है? Let's. Hashimoto's के लिए, you know, it is anti-TPO. Anti-TPO. Anybody remembers other options? Graves, Hashimoto's, anti-TPO. ओके, ओनली वन ऑप्शन की मैच करना था, एंटी टीपीओ हाइपोथायरॉयडिज्म. ठीक है, एंटी टीपीओ हाइपोथायरॉयडिज्म, हाइपोथायरॉयडिज्म. ठीक है, ओके. एंटी टीएसएच रिसेप्टर एंटीबॉडी, लेट्स एंटी टीएसएच रिसेप्टर एंटीबॉडी. ठीक है, ठीक है, okay. So I hope everybody marked this question correctly. Guys, anybody remembers any other question? Anybody remembers any other question related to surgery? डिजीज का नाम नहीं था सर. सर डिजीज का नाम नहीं था, सिर्फ कंडीशन का नाम था. हाइपर थायरॉयड था, ओके, और हाइपोथायरॉयड था. हाइपर थायरॉयड था, हाइपोथायरॉयड था. ठीक है, ठीक है, ओके शिवानी, वेरी गुड. ओके गाइस, प्रोट्रूडिंग आई, ठीक है. एनीबडी रोड ट्रैफिक एक्सीडेंट, फीमेल चेस्ट एक्सरे, नीमोथोरेक्स, ठीक है, वो तो हम लोगों ने डिस्कस कर लिया. फॉलिकुलर डिस्ट्रक्शन, ओके, दैट वी डिस्कस्ड ऑलरेडी. ठीक है, शिवानी गेव द एग्जैक्ट क्वेश्चन, यस, दैट्स ग्रेट. Question was a big swelling on groin area. Guys, there was a question, big question or big swelling on groin area. It was same as that child in which hernia was there. It became more prominent on coughing or crying. Okay, kidney transplant ka, yes, I remember. Renal transplantation, guys, kidney transplant. Kidney transplant, anybody remembers the answer or options? Options? Okay, very good. One question was carcinoma penis mass red color on glans penis. If red colored mass is there, red mass on glans penis, and if it is exophytic growth, if red colored mass on glans penis, then erythroplasia of curate. ठीक है, अगर plaque है and if protruding growth है, in that case we are going to mark what? In that case it is verrucous carcinoma or Buschke-Lowenstein tumor. Cobra head, yes, we discussed cobra head. Okay. Exactly your LRR cobra head given. That is not my LRR, guys. That is the cobra head image being circulated. ठीक है, ठीक है. Okay, guys. So anybody who remembers age of donor, blood relation, money in exchange, is the age. Kidney transplant, immunosuppression, long-term therapy. Yes, very good. So in kidney transplantation, whenever there is immunosuppression, guys, which is the most common malignancy? Squamous cell carcinoma of skin. It is the squamous cell carcinoma of skin. Kidney transplantation, long-term immunosuppression. Kidney transplantation, long-term immunosuppression. Long-term immunosuppression. There is squamous cell carcinoma. ठीक है. Okay, accident, pneumothorax and diaphragmatic hernia. Anybody remembers? There was one question related to diaphragmatic hernia. One question related to diaphragmatic hernia. Diaphragmatic hernia. Another question, swelling in groin pulsating, IV drug abuser, very good. Groin swelling and it was pulsating. Guys, anybody remember pulsating groin swelling in IV drug abuser? IV drug abuser, obviously this patient is having pseudoaneurysm or mycotic aneurysm. Patient is having mycotic aneurysm. Anybody remembers? It's mycotic aneurysm. There is increased risk of cancer. AV fistula bhi tha. Expansile swelling, drug abuser. Guys, that is not AV fistula. It is aneurysm. If IV drug abuser is there, he is using needle there is mycotic aneurysm in femoral. So, that is mycotic aneurysm. In that case, we can go for yes, CT angio we can go for. Bassinis repair. Okay, guys, anybody remembers what was that question related to Bassinis? What was the question related to Bassinis repair? Bassinis repair. CT angiogram tha. There was one question related to secondary hypothyroidism. Secondary hypothyroidism. Okay. ठीक है. Okay. So, guys, these were the questions, right? Anybody who remembers any other question language, please send it to, you can easily message me on Instagram. Any image you remember, any language, you can directly message, or you can mail me on drpritesh@gmail.com. drpritesh@gmail.com. Okay, guys. So, best of luck. I'm waiting for your messages. Yes. Good luck. Good luck, guys. Thank you very much.